Hi, this is Cale Goldfarb with Water and Sports Physical Therapy. Today we're going to talk about a spondylolisthesis. A spondylolisthesis is a defect in the spine. And typically what happens, I'm going to show you on Meredith here as an example. Typically what happens is there's an extension injury. Extension is when you backward bend in this direction and you have a trauma. The trauma, or it could be congenital defect, but the trauma is when you backward bend, you injure one of the pars interarticularis. That is a part of the bone that you can have a fracture, and that fracture allows excess movement. Now the movement that occurs can allow the spine to move forward on itself. Usually it's the lower spine moving on the sacrum, or possibly L4 on L5. But what happens is, if it gets more serious, it can cause possible nerve damage, but definitely causes pain. This type of injury is most common in athletes like gymnasts, other athletic sports with a lot of extension, on volleyball players when they extend their spine to swing, on baseball players when they swing a bat and end up in full extension. You'll usually notice the pain will occur at the end range of motion. Again, a spondylolisthesis can be a very serious condition. If you have pain down the leg, tingling, numbness, or weakness, you have to see a medical provider. Given if you've seen one, we're going to show you some exercises to help out with a spondylolisthesis. So, first we're going to talk about pelvic tilting. A pelvic tilt is a direction assisted movement. So if Meredith could face this way, what she's going to do is a posterior pelvic tilt, which means you're going to tilt your pelvis under. And imagine you're rounding your spine. So this is the same as going into lumbar flexion. You want to avoid extension. So relax your pelvis now and then go into flexion again. That's a posterior tilt. Usually you'll find that that posterior tilt will help alleviate your pain. So now we're going to go the next level, have Meredith lie on her back, and we're going to find a towel roll and place the towel roll under the sacrum. The sacrum is between your pelvis, so you go right under the middle part of your pelvis. Your low back is here, this is below your low back. With the towel roll here, you should feel a gap underneath your low back. Meredith's going to then push down in pelvic tilt and use her transverse abdominis by contracting her belly button, pulling it in and up into her spine. That will flatten out her low back. Then she's going to relax, and she's going to do it again, and pushing down into the table. Again, this should alleviate any of her pain and symptoms while she's doing it. As we progress forward, there are exercises we can do to help eliminate not only the pain, but prevent it from coming back. And that is more of a strengthening exercise. What we would do is we'd pull our knees up to her chest. We'd again do the pelvic tilt, pull your belly button in and up, and then we do a low ab curl where you're going to pull the pelvis up in the air and then down. This is an advanced exercise. If you have pain, you do not want to do this. Pull your pelvis up and down. And again, you're rounding, so you're coming this direction that way. That again is pulling you into flexion, using the correct muscles to support your spine. So, if you have any questions about a spondylolisthesis or other issues, feel free to contact us at Water and Sports Physical Therapy. Thanks.